We need critical thinkers like all of you more than ever. This event is for everyone here, the graduates, their families, their friends, and the dissertation committees, everyone who's been cheering these students in every step of the way. Allow me to thank the supporters of our students for adding them and aiding them through their journey. As is our custom, I invite one of our graduates, Dr. Deborah Wingberg, to come to the stage and provide the charge to the graduates.
Hi, everyone. For those of you who don't know me, my name is Deborah Weinberg, and I guess I can now say that I'm, well, almost a PhD graduate from the Celia Scott Weatherhead School of Public Health and Tropical Medicine. That's going to take me a long time to get used to saying. I imagine a lot of us are in the same position. I know during my on-site I had right after my defense, I forgot that I had passed, and the professor I guest lectured for had to introduce me as Dr. Weinberg. I had said Deborah, and they had to correct me. It was really embarrassing. Given we're graduating from a school of public health, I can't ignore the current state of the world. Not going to lie, it's kind of scary. I think we all know that. But I mainly want to focus on how being graduates of this school and this program have prepared us to continue helping people even in hard times. Most of us, if not all of us, started this program during the height of COVID. More specifically, when COVID was spreading like crazy because public health, like mask mandates, were being ignored and lifted. I know at least 3 of us graduating have done research on COVID-19. And I imagine almost everyone here has had to include COVID variables in their analysis. So I know Yin, for example, in the HPAM department, she wrote her dissertation on incentivizing vaccines in West Virginia. Simone did work on digital intimacies among transgender and gender diverse young adults during early COVID. And Naomi has done qualitative research on compliance with COVID-19 recommendations. At the same time as COVID, Hurricane Ida hit. I think it was during my first or second week of Tulane. Since then, there's been many other climate disasters impacting both Louisiana and the world. And Tulane is at the forefront of that research. So for example, I know Josh published a paper looking at the impact of Hurricane Michael on harmful algae. Keep going though. During my second year, the Supreme Court's made their Dobbs decision. The day it was announced, I went with my roommate down to the district court. We couldn't even begin to count the amount of Tulane students. There's just so many of us there. I'm from DC. I grew up going to protests, lobbying to Congress, but it was a really new experience for a lot of my classmates. And I know that being there helps them understand both the policy process and how to advocate with their research. Since then, I know at least a quarter of us have researched maternal health. Personally, I did try writing a paper on the impact of the Dobbs decision on women's health and contraceptive use. While we weren't able to get funding for the project, just putting together the proposal, I was working with such inspiring professors and students. Others have been able to publish on maternal health. So I know Farah, for example, published a paper in JAMA on birth outcomes and has done a lot of other work with maternal health. We all know that in the past few months, there's been attacks on global health, attacks on drug research, attacks on NIH, CDC, CMS, USAID. I could go on, but I do want to try to keep this happy and a smile on everyone's faces. So, as I said earlier, it's a scary time to enter this field. We all know that. But those of us who've been trained at Tulane, we're very used to doing research in a political environment that doesn't always support public health. Looking out at my fellow graduates, I see a group of people trying to prove that the IRA can lead to better drug access. A group of people proving that Medicare and Medicaid programs can improve diabetes outcomes. A group of people showing that women do have certain hormones we have to take into account, that impact health outcomes, and a group of people ready to tackle global health issues. We are a group of people who have investigated and fought for equity. But more than that, we have the research to back up our claims that we're trying to fight for. I see a group who is ready to take on the world and try to make it a better place, even though things seem kind of scary. Over the past 4 years, I haven't always been in New Orleans, but I have always felt like a part of the Tulane community. Anytime I have a new idea for a project, and those that know me know that happens every other week, if not every other day, I'm always able to find another student to hop on a Zoom to discuss my ideas. They rein me in where needed, and there's things I can't do, but they're also there to support me whenever they can. Anytime I have a methods question, a logistics question, or a question about where to get a dress altered in New Orleans, the PhD WhatsApp never fails. This is all to say that as we navigate the next few years as newly minted doctors and start our careers, I know we're going to be able to make a difference because this is a group of caring, passionate, brilliant, and driven people. A group with the training to do good, but more importantly, the heart to better their communities. So thank you, everyone, and congratulations to the doctoral class of 2025. Please allow me to welcome to the stage Dr. Jian Lee. We can't see him to present the Delta Omega Best Dissertation Award.
Hey, good morning, everyone. It's very hard for me to see. It's a privilege to be here today as a vice president of the Delta Omega Eta chapter to present one of our highest student honors, the Best Dissertation Awards. This award is given to doctoral students whose dissertation reflects outstanding original research and strong relevance to the goals of public health. This spring, we are proud to recognize Dr. Farah Alosh, a PhD in epidemiology. Sorry. For her dissertation titled Effectiveness of a Community Health Worker-Led Intensive Blood Pressure Intervention on Cardiovascular Disease, 4-year findings from the China Rural Hypertension Control Project. Her work stands out for its innovation, depth, and commitment to improving health outcomes in underserved populations. It represents exactly the kind of scholarship our field needs. We celebrate your achievement and look forward to the impact your work will continue to have on public health. Congratulations, Dr. Alosh. Several of them. Which one? This one.
And now welcome to the stage, Dr. Erica Valenzuela, to announce the Dean's Office and Departmental Awards.
Good morning. It is my pleasure to announce these awards that have been received by our doctoral students. First, Farah Alouche received the Dorothy R. LeBlanc Memorial Scholarship Award. This award is given to an epidemiology student showing promise in a research career. Dorothy LeBlanc, a dedicated Tulane professor and field epidemiologist, was highly regarded by students and faculty. Congratulations, Farah. Ming Hao Ku will receive the Mary Elizabeth O'Connor Memorial Scholarship Award. This scholarship, provided to an outstanding epidemiology student, Harold M. Granding, MD, established this as a thoughtful tribute to O'Connor and a distinguished alumna who had extensive accomplishments in the work of international health. Congratulations, Ming. Alyssa Young will receive the Donald J. Krogstad Award for Excellence in Community Involvement in Fieldwork, honoring the memory of a longtime faculty member, former chair of the Department of Tropical Medicine, and distinguished field and laboratory researcher on malaria. The Krogstad Award recognizes a graduating student in tropical medicine in any program within the department, who by their dedication to working locally in communities in Louisiana or in communities abroad, demonstrated passion, patience, skill, and joy in collaborating and empowering underserved populations. Congratulations, Alyssa. Kathleen Koosters will receive the Harrison Spencer Award for Outstanding Student in the PhD program. This award is presented to a student who has shown outstanding student service and excellence in the PhD program, named for the former dean of both the School of Public Health and Tropical Medicine and the London School of Hygiene and Tropical Medicine. Dr. Spencer served 16 years as the president and CEO of the Associations of Schools and Programs of Public Health. Congratulations, Kathleen. For these next two awards, when your name is called, will you please come to the stage? We have two PhD students that will be receiving the Dean Scholastic 4.0 Award. This award acknowledges students' academic achievements, and it recognizes those who have maintained and are graduating with a perfect 4.0, demonstrating superior dedication and commitment. I didn't write that part. All right, I will. So first up, we have Ming Hao Ku. And our second recipient, Deborah Renee Weinberg. I will now welcome Dr. Catherine Andronopoulos to the stage for the presentation and hooding of the graduates. Graduates, when you will enter through the ramp and then off that way. Thank you.
Good morning, everyone. I'm Catherine Andronopoulos, and as the school's Director of Doctoral Programs, I'm honored to be able to present to you our graduates. Graduates, when your name is called, please come forward with the faculty member who will hood you. I'll read a short bio, and then you can place the hood on your doctoral student. Oh, please. Oh, please, graduates, please rise and come to this side. Come to this side to be ready to come forward for your hooding. So our first graduate is Joshua Alarcon, who completed his PhD in Environmental Health Sciences. His dissertation is titled Spatiotemporal Analysis of Microbial Water Quality in Estuarine Watershed, Sources of Fecal Pollution and Harmful Algal Blooms. During his PhD, Josh was the recipient of the Jim and Sonia Miller Scholarship Fund for Deserving Students. After graduation, Joshua plans to start a postdoc or job and hopefully start a family. Joshua will be hooded by Dr. Tiong Ah. Our next graduate is Farah Ismail Alushe. You can come on forward and stand here. She completed her PhD in epidemiology. Her dissertation is titled Effectiveness of a Community Health Worker-Led Intensive Blood Pressure Intervention on Cardiovascular Disease, 4-year findings from the China Rural Hypertension Control Project. During her time as a PhD student, Farah won numerous awards, including the Tulane 34 Award, National Heart, Lung, Blood Institute Early Career Investigator Impact Award, the American Heart Association Award for Excellence in Research Addressing Cardiovascular Health Equity, the Delta Omega Honor Society, and was the recipient of the Tulane Dorothy LeBlanc Memorial Scholarship Award. Post-graduation, Farah joined Tulane as a research faculty member in the Department of Epidemiology. Her long-term goal is to build interdisciplinary teams to continue bridging the gap between public health knowledge and practice. And on a personal note, Farah is currently a purple belt in Brazilian Jiu-Jitsu and has a goal to receive her black belt in the next 3 years, while also supporting more women entering and standing in the sport. Farah will be hooded by Dr. Catherine Mills. Our next graduate is Andrew Andrada. Andrew completed his PhD in International Health and Sustainable Development. His dissertation is titled From Data to Service Delivery, Strengthening Malaria Surveillance and Rectal Artesunate Implementation Across Zambia. After graduation, Andrew will dedicate his time to raising his 2 kids and getting back into rock climbing. And he plans also to pursue a job in malaria teaching and technology. Andrew will be hooded by Dr. Tom Eisel. Our next graduate is Curly Johanna Bernabe. Curly completed her PhD in tropical medicine and infectious disease. Her dissertation is titled Physician Knowledge of Chagas Disease and Disease Burden in the United States. During her PhD, Curly was the 2022 winner of the Tulane Research, Innovation, and Creativity Summit poster competition and went on to present this research at the American Public Health Association conference, where she was inducted into the Delta Omega Public Health Honorary Society alongside Dr. Anthony Fauci, who was in the same group that year. Curly was also awarded a departmental scholarship and several travel grant awards. Her short-term goal is to work in the private sector as a senior scientist. Personally, Curly is looking forward to moving back to NYC and spending quality time with her siblings, John and Karen, and new baby niece, Andrea, brother-in-law, Michael, her dad, Juan, and mom, Esperanza, who, especially having her mom's Ecuadorian cuisine regularly. Curly will be hooded by Dr. Josh Yukich. Congratulations. Our next graduate is Rafilwe Yvonne Batiste Carabo. Rafilwe completed her PhD in tropical medicine and infectious disease. Her dissertation is titled Assessing New Malaria Interventions in Zambia Towards Their Adoption and Achieving Elimination Status. During her time in the PhD program, Rafilwe published a paper in the Malaria Journal titled Time to Loss of Physical Integrity of Attractive Targeted Sugar Baits in Western Province, Zambia, a survival analysis. And post-graduation, she plans to continue her career in public health, particularly malaria surveillance. Rafilwe will be hooded by Dr. Tom Eisel. Our next graduate is Ming Hao Ku. Ming Hao completed his PhD in epidemiology. His dissertation is titled Multidimensional Aging, Signatures, and Health. Ming Hao joined the Delta Omega Honorary Society in Public Health and also won the Mary Elizabeth O'Connor Memorial Scholarship Award. Post-graduation, Ming Hao aims to pursue a postdoctoral position focused on biological aging and chronic disease epidemiology, where he can deepen his expertise in developing early aging biomarkers and contribute to interdisciplinary research teams. Over the long term, his goal is to establish an independent research program that advances understanding of the biological mechanisms of aging and identifies actionable targets for preventing age-related diseases, ultimately contributing to healthier, longer lives at the population level. Ming Hao will be hooded by Dr. Lu Chi. Is that it? I actually get the honor of hooding Ming Hao. Wonderful. Thank you. Now I see how hard it is. Congratulations. Our next graduate is Kathleen Custers. Kathleen completed her PhD in tropical medicine and infectious disease. Her dissertation is titled Population Genetics of Schistosoma hematobium in Senegal and Gabon, Analysis Using a Novel R Package, Transmission Dynamics, and Hybridization. During her PhD, Kathleen was awarded several scholarships, including the Bazzano Award for Professional Advancement, the David Spencer Scholarship, and the Department of Tropical Medicine Doctoral Scholarship. Post-graduation, Kathleen plans to continue working in applied epidemiology and global health, using data to drive real-world solutions for controlling infectious diseases. On the personal side, she'll be planning her wedding and finally catching up on some sleep. Kathleen will be hooded by Dr. Ronald Blanton. Our next graduate is Brooke Mancuso. Brooke Mancuso completed her PhD in tropical medicine and infectious disease. Her dissertation is titled Coverage, Cost, and Cost Effectiveness of Attractive Targeted Sugar Baits in a Phase 3 Cluster Randomized Controlled Trial in Western Province, Zambia. Post-graduation, Brooke hopes to continue her work and research in malaria and NTD prevention. Brooke will be hooded by Dr. Josh Yukich. Our next graduate is Naomi Patterson. Naomi completed her PhD in Social, Behavioral, and Population Sciences. Her dissertation is titled Disability and Pregnancy in Louisiana, a Pregnancy Risk Assessment Monitoring System, or PRAMS, data analysis. Naomi was the recipient of the Tulane Program to Advance Representation in Minority Health Research Fellowship. Her short and long-term goals are to take on roles where she can leverage her research, writing, and analytical skills to drive meaningful impact in public health. I am honored to present Naomi with her doctoral hood. Congratulations, very proud of you. Our next graduate is Simone Skeen. Simone completed her PhD in Social, Behavioral, and Population Sciences. Her dissertation is titled Passive Suicidality in a Repressive U.S. Political Context. Simone is a Delta Omega National Honor Society and Public Health inductee. She has won numerous awards from the Society of Behavioral Medicine, including the HIV and Sexual Health Student Paper Abstract Award in 2023, a Health Equity Abstract Honorable Mention in 2025, and Meritus Abstract Awards in 2023 and 2025. Her team won the startup competition at Tulane's inaugural AI and Healthcare Design Lab in 2024. In June, she will begin a postdoc fellowship funded by the NIH in adolescent and young adult HIV biobehavioral science at the Warren Alpert Medical School of Brown University. There, her work will examine drivers of self-destructive decision-making, mindfulness, applied AI, and digital therapeutics optimization. Simone will be hooded by Dr. Gretchen Klum. Our next graduate is Ling Tian. Ling completed her PhD in epidemiology. Her dissertation is titled Sex Differences in Social, Behavioral, and Metabolic Risk Factors for Cardiovascular Disease Among U.S. Adults. During her time in the program, Ling was first author on 5 manuscripts, was a co-author on 9 manuscripts, and has been invited to present at several national conferences, as well as present as a speaker at the Tulane Research Creativity and Innovation Summit. Ling also won a prestigious training fellowship from the American Heart Association to support her predoctoral training. Ling has already started a postdoctoral fellowship at Northwestern University. Her long-term goals are to build a career in academia and spend more time with her family. Ling will be hooded by Dr. Kristen Dorans. Our next graduate is Yin Wang. Yin completed her PhD in health policy and management. Her dissertation is titled Moving the Needle, Empirical Evidence on Vaccination Policy. Yin states, I am deeply grateful for the time I've spent and the support I've received at our school, at Tulane, and in New Orleans. Yin Wang came to Tulane on a Dean's Research Council scholarship. Her academic accolades include winning first place in the National Delta Omega Scientific Poster Competition at APHA in 2023. Her papers have been twice selected by journals as podcast features, once in JAMA Conversations, and once in Health Affairs Podyssey series. When not running STATA, Dr. Wang spends her time making pilgrimages to study with masters at Buddhist temples. This fall, she will start at Zhengshuo University, China, at the rank of associate professor on the tenure track. Yin will be hooded by Dr. Charles Stecker, who, along with all of us, are incredibly proud of her. Our next graduate is Deborah Weinberg. Deborah completed her PhD in health policy and management. Her dissertation is titled Evaluating the Impact of Remote Patient Monitoring in Medicare Beneficiaries with Chronic Conditions. During her PhD, Deborah received several travel grant awards, one from the International Society for Pharmacoeconomics and Outcomes Research, which was in Copenhagen in 2023. And she was recognized in the top 10% of abstracts for this conference in 2022. She also received funding from the Tulane Health Systems Analytic Research Center. After graduation, Deborah will be joining the faculty at Georgetown University as an associate professor in their Health Management and Policy Department. Assistant. Well, the associate will be the next one to come. And the Department of Health Policy and Management, also working as a consultant for pharmaceutical companies. In the short term, she hopes to combine her political, industry, and academic networks to create opportunities for students and improve research. In the long term, she hopes to hold more leadership positions and continue her travel checklist and make it to all 7 continents. Deborah will be hooded by Dr. Li Zhang-Shi. Our next graduate is Dennis Chuan. Dennis completed his PhD in health policy and management. His dissertation is titled A Risk Analysis Engine for the Linkage and Prediction of Interconnected Sequelae Due to Hypertension. Dennis will be finishing up his projects at Tulane and then moving towards pharmaceutical and biotech industries to begin his professional career. On a personal note, he will travel to celebrate graduation. Dennis will be hooded by Dr. Li Zhang-Shi. Our final graduate is Alyssa Young. Alyssa completed her PhD in tropical medicine and infectious disease. Her dissertation is titled Predicting Malaria-Specific Healthcare Access and Utilization in the Democratic Republic of the Congo, a synthesis of geospatial treatment seeking and provider-based determinants. Alyssa's short-term goals include publishing her dissertation, as well as working as a consultant in infectious disease epidemiology and geospatial modeling. Her personal goals include hiking the Ophis Dyke Trail, is that how you say it? A 177-mile trail along the border of England and Wales, and most especially doing it with her dad. Alyssa will be hooded by Dr. Tom Eisel. Oh. So as you can see, our doctoral graduates are an inspiring group with integrity, intellectual curiosity, and a dedication to improving health. Their success is a result of their tenacity and perseverance, but no person is an island. And so I want to thank the parents, spouses, children, and friends who are here today and who supported them on this journey. On behalf of the faculty and staff at Tulane, we thank you for the opportunity to teach and work with your loved ones. To our graduates, as you embark on your next steps, I urge you to stay true to the passion that drew you to a career in research and public health. It is in that passion that you will find innovation and meaningful work. I would like to thank everyone who made the event today a success, including our Office of Student Experience, our communications team, and our IT team. This concludes the formal program. I now welcome you to join us in Diboll for refreshments. Faculty and graduates will process first, followed by family and guests. We also have a photo backdrop, which I hope you will take advantage of for some pictures. And most importantly, I want to again congratulate our class of 2025. Congratulations.